Welcome to the Kidsville Pediatrics YouTube channel.
Hi everyone, this is Dr. Boone with Kidsville. I'm located at the McKinney office. So today let's talk about the measles. So if you have been listening to the news lately, you know that there's been a pretty big measles outbreak, particularly in West Texas. So let's talk about what you need to know about measles and how you can help protect yourself and your family. So measles is a virus and it can be spread by respiratory droplets, and it also can be airborne. So it's actually one of our most contagious viruses that we have. Luckily, there is a vaccine. The kiddos typically get that at age 12 months to 15 months as their first dose, and then their second dose is usually at age 4. But they do have special considerations when there's an outbreak. So if your kiddo is under 12 months old but is over 6 months old, they can get their first measles vaccine early. So if you want to, I would recommend getting that early for your child. So between 6 months to 12 months, come in early, we'll do that first dose. But do know that that first dose does not count towards the 2-dose series that your child will need. So by getting that first dose of the MMR, you have a 95% immunity to measles. But by getting that second dose, you increase that to roughly 97 to 99%. So I would recommend getting both doses. Let's talk about the symptoms of measles. So when everyone thinks of measles, they think of that very characteristic red rash. But sometimes that doesn't always happen, and that usually occurs 4 days into the virus. So let's talk about some of the early signs and symptoms that you might see that you don't want to miss in your child. So it can start off like any other cold. So runny nose, red watery eyes, and a cough. Those are all pretty non-specific. So sometimes that can make it very hard to figure out if this kiddo is having measles or is it just some other bug. But then by day 4 is when that rash usually pops up and the diagnosis is pretty clear. So if you see your child have any rash along with watery red eyes and a cough, I would call your pediatrician, see if they can schedule like a virtual appointment or something, but also keep your child quarantined at home so that we can protect others and keep them safe. So it's important to note that measles doesn't just cause a rash and just cold-like symptoms. It can actually make you pretty sick. So one of the most common complications are respiratory problems. So these kiddos can get pretty sick. Sometimes they get pneumonia, require hospitalization, put on oxygen. But one of our other kind of complications that everyone is scared about is the brain problems. So it can cause something called encephalitis, which is swelling infection of the brain. And that can cause sometimes long-term damage. So that's why the MMR vaccine is very important. And thank you for listening to this talk about measles. If you have any other questions or concerns, don't hesitate to contact our office or give us a call and we will continue that discussion. Thank you.